Do you have trouble with uncontrollable shaking? Are you unable to use a spoon without the food falling off?
Has your physician diagnosed you with Parkinson's disease? Carbidopa-levodopa might be the drug for you.
Levodopa-Carbidopa, brand name Signmet, is an anti-Parkinson agent. According to CARD, Parkinson's disease is a progressive chronic neurological disorder that can affect people of any age, but it's most typically seen in those who are middle-aged and entering in their 60s. There is no known cause as to why this disease is happening, and there is no cure. Some manifestations of this disease includes rhythmic tremors, lack of coordination, rigidity, trouble maintaining position and posture, bradykinesia, a shuffling gait, mask-like expressions, and dysphagia. Parkinson's disease does not affect the higher levels of the cerebral cortex, so a very alert and intelligent person can be trapped in a progressively deteriorating body. Therapy management is really important, and it aims to treat the signs and symptoms to provide optimal functioning for as long as possible. So how do you know if you need treatment? According to Waller, Williams, Morales, and Fung, treatment should be initiated if there is any type of disability, whether that be social or physical. Effective treatments are available for the motor symptoms of Parkinson's disease, and that might include tremor, stiffness, and slowness, but also to help problems such as constipation, lightheadedness, insomnia, anxiety, and depression. Delaying treatment is of no benefit. The medications used are well established and are typically well tolerated by all of their users. Some other indications for taking this drug would be Parkinson's disease, chronic manganese intoxication, cerebral arterial sclerosis, motor fluctuations in advanced Parkinson's disease, and Parkinsonism resulting from carbon monoxide. According to the Mayo Clinic, the first symptom of Parkinson's may be a barely noticeable tremor and just one hand. Although tremors are common, but the disorder may also cause stiffness or slowing of movement. So in the earlier stages of Parkinson's disease, your face may show little to no expression, your arms may not swing when you walk, your speech might become soft or slurred. Parkinson's symptoms do worsen as the condition progresses over time. Although Parkinson's disease can't be cured, medications can significantly improve your symptoms. Occasionally, your healthcare provider might suggest surgery to regulate certain regions of your brain and improve your symptoms, but because the cause of Parkinson's is unknown, there's not any proven way to prevent this disease from happening. Some of your typical signs and symptoms of Parkinson's disease are tremors, trembling of the hands, arms, legs, jaw, and face, stiffness in the arms, the legs, and the trunk, slowness of movement, and poor balance and coordination, as well as speech difficulty, and it can later result in swallowing difficulties. Levodopa-Carbidopa is the drug of choice for managing Parkinson's disease. According to Assessment Technologies Institute, Levodopa-Carbidopa works by promoting dopamine synthesis. It activates dopamine receptors and prevents dopamine breakdown, promoting dopamine to be released. And it also blocks the degradation of levodopa. Some of the common dosages with this drug is 100 milligrams of levodopa with 10 to 25 milligrams of carbidopa. And this is by mouth 3 times a day.
Carbidopa-levodopa is the drug of choice to slow down the progress and reduce symptoms of Parkinson's disease. According to Skidmore-Roth, it is available in PO, immediate release tabs, PO extended release tabs, oral disintegrating tabs, and internal suspension via tube feedings.
How much do these drugs cost, you might ask? The immediate release oral tablet typically costs around $12.98 to $15.94 per 30 tabs. Oral disintegrating tabs typically cost about $94.16 to $110.83 for 100 tabs. The extended release oral tablets cost about $37.67 to $67.26 for 100 tablets. For the enteral suspension, it typically costs around $1,619 for a supply of 700 milliliters.
According to Assessment Technologies Institute, when taking this drug, you need to watch for reduced effects of levodopa with foods containing large amounts of vitamin B6, as well as checking your blood pressure and changing position slowly due to this drug causing orthostatic hypotension. This drug is beneficial effects diminish by the end of 5 years. Weaning off effects may occur at the end of dosing intervals, indicating medication levels are subtherapeutic. According to the Assessment Technology Institute, what you're going to want to do is eat protein in several small portions during the day. Avoid vitamin preparations and food containing pyridoxine. Also, make sure you're familiar with the signs and symptoms of toxicity, which includes muscle twitching and blepharospasms.
Approximately 10% of those with Parkinson's disease have a family member also affected. However, usually there are many factors involved rather than a single gene. Having one close family member with Parkinson's disease increases the risk of developing this disease by approximately 2%. Some common adverse effects associated with this drug include involuntary coliform movements, hand tremors, nightmares, orthostatic hypotension, nausea, and discoloration of the urine. Some serious side effects include neuroleptic malignant syndrome, suicidal ideation, hemolytic anemia, leukopenia, agranulocytosis, and thrombocytopenia. Some more serious side effects can occur if taken with an MAOI. This can increase your risk of a hypertensive crisis. Also, you need to be aware that toxicity can occur, so you need to be watchful of the signs and symptoms of toxicity, including muscle twitching and blepharospasm.
Carbidopa-levodopa has improved so many lives, reducing their symptoms that create a problem with everyday tasks. For the price of $37.67, you get a supply of 100 tablets. Call your provider now. But wait! There's more! If you head to your local pharmacy and call your provider, you'll receive a coupon for 10% off your first prescription.
Hurry and call your provider while supplies last. Coupon is only valid for first prescription fill.
Don't wait! Call now!